Hello, everybody. Welcome to another episode of What's Next After BDS. And today we have Dr. Narasimhan, a very good friend of mine. Dr. Narasimhan has finished his PhD and currently working as a research consultant in his own firm. If that's the way you should put it. So, sir, can you give a short intro about yourself as to what you're currently doing?
Yeah. So hi everybody. So to introduce myself, I'm basically a dentist. I finished my dentistry and went for a post-graduation in biomaterial science. In this juncture, I would like to
There's a
open
slight, there's a
a
slight disturbance in the audio, sir. Is it okay if you can adjust? Then we'll proceed, sir. No problem. Just a slight disturbance in the audio.
Are you okay now?
Yeah, much better.
Am I audible?
Yeah, much better, much better.
Yeah. So there are numerous courses for post-graduation in dentistry. Of course, beyond MDS, we have a lot of MSCs. Like all basic sciences courses are offered as MSCs, of which I took up biomaterial science, equivalent of a dental material science, but is a wider perspective.
Okay.
So I finished that from Savita. Then I went for doing PhD in same material science from Madras University. I worked in Central Leather Research Institute as a laboratory for working.
Okay.
So my area of interest is implant tissue interface. That is what my specialization is. So how materials react with the tissue. Any tissue it might be. I specialized on bone naturally as a dentist. So yes, any other tissue interface can also be studied. It's doable.
Okay.
So this is my profile. So from here on, I would like to take up your questions.
Yes, sir. So talking about your research consultant, sir. So I probably got your contact when I heard that you help people, modify their manuscripts or sometimes even write when they submit their data. So I was actually taking help for my thesis work. Like once I finished my post graduation and I had intentions of publishing it, so I had to take an help from you, sir. So what made you, think like this could be a good service, and actually it's a wonderful service. So can you just give a brief?
Actually,
Yes, sir.
this began a few years ago. I was working with some academic institutions where I really felt the staff members who want to do, staff and students who want to do research are heavily handicapped by the regular academic schedule.
Okay.
So staff have to attend classes, they can't move outside to do research, and students are attached to a curriculum. They have to complete it within the stipulated period of time.
Okay.
But as I have experienced research should be done in a very free-flowing way. You can't do something else along with research.
Okay.
So I came across some of my colleagues who were saying that if I can help them with their research projects, so then we can form the idea of coming out of it, because even I was in an academic institution. So the same problems I also
Sorry,
had.
sorry to interrupt. Once again, on the audios, there's a little bit of haziness.
Is it okay now?
Yeah, much better, much better. Yes.
Yeah. So when I was in the academic institution, I was also facing the same problem. So then was born the idea of coming out of the academic institution and to cater the needs of people who are in the academic stream. Now, research is a very simple word to utter, but it has the entire spectrum of requirements. For example, the first thing is how to design a research. What is the problem? How to define a research problem? We begin from that stage till completion of your manuscript or thesis or your dissertation, whatever you want to call it. So until that stage, there is an entire spectrum of requirements for both students and staff and even freelance researchers. Some people have good ideas for doing the research, but they don't have the means to accomplish that.
Correct.
Some people have a lot of lab facilities, but they are wanting for ideas. Some people will give ideas to them, then they have to do it. Then people might have completed the research in a very effective way, but a good writing is one that is going to make your research visible to the world. So that stage, there are several requirements like language, grammar, then what to put first, what not to put in the manuscript, all these things. So I decided to adopt the entire spectrum as my profession. So research service may be required at any point in this entire spectrum. So I take up work, or I take up projects for research design. Not only in the academics, I also work for industries also. So in industrial aspect, there may be a requirement for a continual improvement of the product what they have done. For example, and in an industry, in a manufacturing unit, they usually buy the technology from a research institute. Then they will manufacture it, sell it. But over a period of time, they will want certain improvements to the product. For example, better tensile strength, better porosity, or better surface properties. Like that, they might want continual improvement for their product. So since I am a material scientist, that is a biomaterial scientist, I can ably link between the engineering principles of the material design with the clinical use.
Okay.
So that is where I fit in. So to be very clear, I'm a person who will link all the multiple disciplines to bring out a single product.
Amazing, sir. Amazing. So, what exactly, if I can, put it in short, is like there's somebody who has an idea to, do a research work. But whatever your idea maybe is, when you want to present it to the world, there is a certain format in which it has to be published.
Yes.
Although your
Yes.
grammatical skills might be really good, I personally experienced when we had talked earlier also about my issues, like however good your grammar is, you have to write in the grammar in which the journal expects you to write, right? You have
Yes.
to bring it down to, and you are
What
doing
people
this service.
understand.
Yes, exactly. And you are doing this wonderful service. Sir. Nice to know, sir. So, what exactly pushed you to come inside this? Is it because you finished your PhD? Yes, one you told me is that you could see all your colleagues inside this. I mean, colleagues struggling to put their ideas on paper. So, is it possible that only if you finish your PhD you can do something like this, or it comes with time?
Not necessarily. Not necessarily. See, to be very frank, when I finished my BDS, I did not imagine that I'll be doing this profession after another 12, 13 years.
Okay, okay,
I was a normal boy who thought of doing a PG and settling down in an academic institution. But my destiny gave a different turn.
okay,
So I couldn't do an MDS.
okay.
So I had to find my way out. Even after doing a PhD, I was thinking of attaching to a good research lab so
Mm-hmm.
that I can develop my own projects and bring it up. But then at one point of time, I realized that world doesn't require new ideas. Ideas are already there. What is required is to convert them into a usable form. So that is where the lacuna was there, and that is where I thought I am good at, and I push myself into that.
Okay,
To do that, what you will actually require is a good aptitude towards research. You may not require a PhD to do this.
okay.
So, and basically, you have to understand another aspect that in a research today, in today's scenario, all researchers are multidisciplinary. So don't imagine that you have to be specialist in all the disciplines.
Mm-hmm.
So you have to just tie up with 4 or 5 people and you can do a project. For
Okay.
example, you might be great at a clinical subject. You can give a clinical problem. As you are a surgeon, you might feel that a particular material may have to be improved to be put to a better use in clinical dentistry. So once you have devised such a problem, after sufficient literature survey, you will become an investigator. Now, what is required is you will find an engineer or a material scientist or a suitable person who can modify the material and give you.
Well,
So you don't require PhD to do this kind of product development.
okay, okay,
PhD is an academic thing.
okay,
So you can do it later. It actually is a feather to your crown. You can do it later. Once you see, if you finish your BDS, you have a good idea, you want to begin a company, that is enter into an entrepreneurship, you can do it.
okay, okay,
You just need good contributors for your project.
okay, okay.
Once that is there, one you
What
can turn into
exactly do you mean
entrepreneur.
by contributors, sir? The contributors as in?
Contributors means ideas. See, to develop a project, you require multiple things. One is an idea. You might be good at one part of the problem. You might want contribution idea from other person who's an expert in that discipline. Then you might want a person to bring in finances to develop your company or to develop your project. Every project requires a finance. You can't just like that do a project. So that you need financial people support. Then you need infrastructure support.
Mm-hmm.
So all this may not be available with one person at one point of time. It's not an ideal life, it's a real life.
Absolutely.
So we might want such tie-ups with people. So you can fit yourself into one position and then take help of others to accomplish your goals.
True, true. This actually reminds me of one of my professors who once told me, like, however new your idea you think it is, there will be somebody in the corner of the world who's already thought of it. So
Yes.
it's entirely lies in the way you write it or the way you project it to ensure, like, people are awestruck at the way, okay, this guy has come up with something new. So
Yes.
literally,
That
literary services make a huge this thing, sir. Okay. Now my next question will be like, say someone, you said a master's is required before you proceed to your PhD. Okay. So you can do a
yes.
master's, something like what you have done in like biomaterial sciences, if I'm not wrong. Biomaterial sciences.
Yeah.
Correct. So if after doing
Yes, I did my biomaterial.
yeah, after doing a PhD, see, many of us want to do a PhD, but can you at least briefly tell what are all the possibilities of someone who has a PhD and what all can be done from a PhD? Like now, say you've got your PhD. So what all can be done? Now you're into research, so you're doing this wonderful service. Anything else which can be done?
You are asking about scope after doing PhD?
Correct.
See, one main pitfall of our academic curriculum is they don't teach you how to market yourself. They stuff your head with all knowledge, but
Okay.
the way how you market yourself in the public. See,
Mm-hmm.
once you finish your degree and you're out of an institution, you are an individual. World sees you as an individual.
Correct.
So you have to market yourself. After finishing your PhD, you have multiple opportunities. First, an obvious opportunity is an academic institution where you go back, do the teaching, do research, produce more PhDs, produce good quality postgraduates, all that thing. Then next possibility is an academic research institution where they do a lot of research and will require your inputs to perform the research.
Okay. Okay.
Next part of the story will be industrial research.
Okay.
See, in industry, there are a lot of people who are chemists and physicists who are working on materials and drugs.
Okay.
They require input from clinicians. For example, if you have a company and you have a material, you want a clinician to place it in the patient and give the result. Only then a company can survive, any sort of company.
Okay. So, but one question
So you
here.
can join any.
Sorry to interrupt. One question here, sir. You had done your master's in biomaterial sciences, and you are able to help the industries because you know something about the masters. For a clinician, say something like, I did my PG in maxillofacial surgery, and if I going to do my PhD, will I still be useful to the industry? Like, I mean,
Of course, yes.
yes. Just I just want to know how.
Yes, see, if Dr. Vinay Sundar is a PhD, for example, just example, if I'm having a company, who manufactures titanium mesh,
Okay. Okay.
I will contact Dr. Vinay to ask about what are his clinical requirements, how thick you want my mesh to be, how thin you want it, you
Okay.
want any
So,
modifications.
okay, okay, okay. I get it now. So it's
So
basically what are all the materials you as you will be using based on your master's degree, and that will help the industrialists develop further products or
yes,
improvise their existing
always,
products.
always there should be a very close interaction between clinicians and the material scientists in the development. Only
Amazing.
then a sensible material can be developed.
True, makes sense. Makes sense. Really good sense here,
So
actually. So,
main place where we have this problem is the terminology what a clinician uses will not be decipherable by an engineer.
okay,
And an engineer, whatever he speaks is going to be Greek and Latin for the clinician.
okay.
Now, in that place, if you can train yourself by reading some small length articles or books, from the different journals. See, main problem why we encounter this is because in our post graduation we are taught to look into the journals that are only belonging to our specialty.
True.
So what happens? You are only thorough with your set of jargons, and you talk about all these things. Nobody on earth will understand this. Only your community will understand.
Absolutely.
So if you start discussing with journals which are a little away, for example, as a maxillofacial surgeon, you might want your students in college to discuss about biomaterials, acta biomaterialia, then Journal of Biomedical Material Research. These are all interdisciplinary journals. There are lots of papers on implants there. There are a lot of papers on bone grafts there. Once you start reading those articles, then you get to know how to interact with non-dentists.
Okay. Okay.
Now, in dental profession, there is a problem. Like, we are afraid of interacting with others because we are afraid they will not understand what we talk.
Okay. Okay.
This path has to be broken so that we can find our better placements in multitude of places.
At the same time, sir, as much as you, I completely agree with you in this point, like where you're not interacting with the other interdisciplinary specialities. In general, what, as far as I've heard or experienced, is when the DCI come for inspection, they check what publications you have, right? They expect you to have publications in your specialty more than you publishing for other journals. They say, like, you are a maxillofacial surgeon or maybe an endodontist or something like that. They said, why are your
I'm not asking you to publish in that.
No. I'm just saying. So, but does that even actually make a difference according to you?
That.
No, I'm asking, does that make a difference? Because a research is a research. Sometimes you feel this journal topic or this research topic will be more apt to be published in this particular journal. According to you, do you think it makes a difference?
Yeah. See, when you have a research work done or research work planned, it need not be entirely clinically based. Now, doctor, just imagine: is there any single material in your dental material textbook that has been designed for dentistry? No. Beginning from your plaster of Paris, it was not for dentistry. It was adopted and adapted.
Okay.
Titanium, was it manufactured for dentistry? No.
How about putty, sir?
Bioceramic? No.
Putty?
All these are improvised based on industrial putties.
Okay.
See, so what happens is there is one intelligent dentist or an industrialist who is able to link both these and manufacture it and market it and earn out of it.
Amazing, sir. Amazing. Okay. This actually, kinds of makes me think differently after I was interacting with you this way. Yes. So this is, so you get, so after PhD, so one option is to be affiliated with a college, academic institution. The other is a research lab. And the third is, as you said, with an industrialist or something like that related to our field, who is expecting always a scope of implementing their respective product, right?
Yes. You can also be an entrepreneur after that.
Okay. That's nice. So
the possibility,
yes,
once you say entrepreneur, the possibilities are skyrocketing.
Correct.
You can take up anything.
Absolutely, sir. Sir, so one last question, sir. So can you briefly tell about your consultancy services, sir? Because I have given my I given my manuscript to you, requesting you to do for the modifications. So you do it for a minimum charge here. So if you could say how it works, probably people can approach. And is it okay if I can share your email ID at the end of this so that people can?
Sure, you're free to share it. Okay. See, my consultancy services work like this. Okay, I have many services to be provided. First, most commonly people come to me for writing a manuscript or editing a manuscript. So my job will be to put things into perspective. Many times people think they have written a full manuscript. It will seldom be complete in any aspect. So you have to add what is required to project your study. For example, if it is a manuscript, introduction, why you do the study, what is the background, then what is the lacuna in the literature, why are you performing this study, then the methodology. In methodology, what should be included, what should be excluded. Then we're writing the results. How much of results should be projected, what is not needed. Discussion. What is the other people have done, what is the relevance of your article, then conclusion, what are you trying to say from this article, what is the clinical implication. So this kind of information should be received from my clients to be put into their own manuscript.
Okay.
This is one thing. Next, we do statistical services. We do statistics for paper, thesis, whatever, wherever statistics are involved, we do that. Then we do study design. That is, for example, some students come to us in the beginning of the research. That is when they are in first year of their post-graduation, PGs, of any discipline. They come to us to design their study. That is, will that
the
study
beginning
be
stage
good
itself,
enough to complete a thesis?
You're talking about the beginning stage itself, even before they go into doing the actual study. Okay. Hello, sir. I think your line is got stuck.
Yes. Yeah.
Yeah.
Now going on?
Yeah, it's clear.
Yes. So in the beginning stage, the first year, when they decide the thesis topic, that is when you have to catch them.
Okay.
You have to design the proper study, proper statistics. Then see, most of the students, they make a mistake in deciding the study that they can't write a discussion for that study.
Okay.
Like you do a very small work, it is not statistically sufficient. You can't write a discussion. They end up writing stories that will not be publishable. So you should have a very long sight. Like you have to look into your future 2 years ahead and see that you can make a worthwhile publication out of it.
Absolutely.
So that stage we help. Then many things, that since I'm a material scientist, I take up your sample, I give it to so many labs to process your sample, then I give you results and interpretation. This is the next thing. See, you might take a SEM image. I have seen some cases where they have made SEM images and they don't know what to write about it. So from papers, they say, okay, SEM is the methodology. You do the SEM for your implant, or you do the SEM for your tooth or whatever after any processing. Now, how to write it? How to present it so that it is scientifically acceptable?
Correct.
So we provide entire range of services, right from research, design, execution, statistical analysis, writing the sense thesis or the manuscript.
And most importantly, you have to be quite specific about the journal also you're choosing, right? Because each one of them have different expectations.
Yes.
Thank you, sir. Thank you so much.
So see, that's a huge,
Yeah. Please continue. Sorry. Please continue. There's a lag here. We're talking about the journal.
That's a huge thing before you start your manuscript for publication.
Okay.
So who will publish your work? That is what you have to select first.
Correct.
So
thank you.
So I would add one more point here.
Please do.
See,
please.
One event that happened in 2008.
Okay.
When I was a postgraduate student.
Okay.
I joined my biomaterial science. Then I went to we were so immersed in our future. What is going to be there after completing this MSc and other things. So to take advice, me and my senior, we just went to MGR Medical University, Gindi.
Okay.
To talk about PhD. That time, people PRO directed us to the academic officer. That time, I know Dr. Alvar. He was a neurosurgeon. He was the academic officer there. He met both of us, and he was shocked to think that dentists are, brave enough to take some other course other than MDS.
Oh.
What will you do after that? Like that. Then after a moment, as an academic officer, he was so efficient. He asked us, okay, you did MSc biomaterials. What are the other courses in your university? Then we told him, like, we have anatomy, physiology, biochemistry, pathology, pharmacology, microbiology, oral biology, all these things we have, he said. Then he said, as a graduate of this university, you are a graduate of this university. I did my UG from MGR Medical University.
Okay.
So as a graduate of this university, we are interested in your future. Till date, we have not included these degrees as eligibility criteria for PhD in our university. Now you have opened our eyes. I will